everyone, welcome back to another role play discussion. I am 𝗤𝗶𝗵𝗀 and today I am here with 𝗥𝗶𝗵𝗆 and we are going to do another cue card where we are going to see a patient who has been recently diagnosed with vitiligo, right?
Yes.
So Miss will give you more details about what is the scenario.
Okay, the scenario is based on a skincare clinic where the patient comes in for further details and certain explanation, requesting for certain explanations to solve her problems, and also we will be giving some console statements.
We will be supporting the patient.
Yes.
The most important thing we have to note here is that the patient is just 22 years old and
it's very embarrassing.
And she's a college-going student. So we can imagine that. Actually, we can't imagine that for a person with vitiligo, it might be really difficult for them to present themselves in front of others, especially for a college-going student. That might be a trauma, actually, right? So here, the main task of the nurse is to emotionally support this patient and provide all the necessary information. So let's see how this goes.
So Miss will be doing the part of the nurse and I will be doing the part of the patient.
All right, so let's start.
Okay.
All right.
Your time starts now.
Good morning.
Good morning.
I'm Richa. I'm the registered nurse on duty today.
Okay.
So please be seated.
Thank you.
How can I help you today?
See, I have been recently diagnosed with vitiligo, and I can see that I have certain patches on my face and hands, and I'm really upset about it because I'm a college-going student, and it is very embarrassing to present myself in front of the society.
I'm really sorry to learn that you're going through a very rough time, but please don't worry. Let me see what I can do to help you. Okay?
Thank you.
So, are you here to know more about vitiligo?
Yes, exactly.
All right. Okay. So, I'll definitely explain that to you.
Thank you.
So, before we get into the further discussion, let me ask you a question. Do you know anything about vitiligo?
I know that it is some kind of skin problem, but I would like to know more about it and what exactly I can do to tackle this problem.
Don't worry, I'll definitely help you with that, okay? So before we proceed further, could you please tell me your name?
Yes, I'm Sarah and I'm 22 years old.
All right, Sarah. So Sarah, vitiligo is a condition, it's a skin condition in which the skin loses its pigment cells. Again, that is the reason why you have been experiencing all this loss of skin in patches.
Okay.
That is why you have all these patches all over your skin, especially on your face, your neck and your hands, okay? So that is what the condition is called. Do you have any concerns that is bothering you about it?
Yes. Can you please tell me why is it happening?
Well, there are various reasons for vitiligo, okay? Normally, vitiligo occurs when the pigment-producing cells, it loses its ability to produce melanin or it dies.
Okay.
Because only when the melanin is produced properly, that will give the proper color to the skin. I hope you know that.
Yes.
So, in this case, what happens is these pigment-producing cells die or they are unable to produce the enough melanin for your body. And the exact case of this, the cause of this is unknown. But studies, it shows that it might be related to some autoimmune condition or family hereditary. So do you have any family history of this?
No, nothing like this.
Not. Okay. So, or it can be even caused by any triggering events such as stress.
Okay.
You're a college-going student, so you might be experiencing severe stress from your studies and things like that. Or it can be even caused if you are overly exposed to sun, or if you have a severe sunburn, or if you come in contact with harmful, hazardous chemicals. So have you ever come in exposure to any of this?
I don't remember anything like that.
Nothing that you remember of,
Yes.
okay? Well, all I was trying to say is that these are the various reasons why a person might suffer from vitiligo, okay? Well, I hope that is clear for you.
Yes.
Do you want me to explain anything else?
Yes, could you please tell me, will it spread again?
That's a reasonable query, and I know it is really upsetting for you, especially you're a college-going student, and it might be really embarrassing for you and difficult for you to present yourself in front of others. I know you're having a very difficult time, but please be relaxed, okay?
Okay.
And this is just a skin condition, and we do have some treatment options for that as well. So coming to your question, you asked me about the spread of it. So now you might be noticing that it's spreading really quickly, right?
Yes.
Well, and initial days, that means for the first 6 months or for the first 1 year, the spread of vitiligo might be a little higher, okay? You might notice that it's spreading so fast. But after a point of time, it might stop abruptly and it will be constant for a very long time.
Okay.
So it varies from person to person as well. So I won't be able to tell you a definitive explanation about whether it will get worse or whether it will stop. This is a normal nature of how it happens, okay? So we have to see how it goes in your case too. But don't worry, we do do have a lot of treatment options too.
Okay.
So do you want me to discuss about that?
Yes, of course.
Absolutely, I'll take you through that. So as I mentioned, we do have some treatment options such as repigmentation, depigmentation, or sunblocks, or ultraviolet light therapy as well. So these treatments will help to improve the appearance of your skin.
Okay.
So do you want me to give more information about that?
So will it cure completely with all these treatments?
Well, regrettably, there is no complete cure for this particular condition. I know it is really a shock for you, and it is worrying you so much too. And you would have been expecting that there is something that we can do to cure it too. And
yes.
I'm so sorry to say that we cannot cure it completely. The only thing we can do is to make your skin looks a little better by doing any of the treatments that I mentioned.
Okay.
So that is the only solution we have right now.
Oh, I see.
I know it's not making you happier. That's not the answer that you've been expecting, but please be strong. We're all there to help you. All you need to do right now is focus on your studies, and it's just a skin condition. And again, although it is not curable, we do have treatment options to make the appearance look better too. Okay, so you don't have to worry about it.
Okay.
And on top of this, I would like to give you a suggestion about changing your diet into a nutrients-dense diet. Try to include more of plant-based diet in your diet. Okay, plant-based food in your diet, and on top of that, drink a lot of water, which is really good for your skin. So do you normally drink a lot of water?
No.
Okay, please make sure that you drink a lot of water.
Okay.
Fluid intake is really important in this case too. Okay, so these are the few things that I would like to discuss about vitiligo with you. Do you have any other concerns bothering you?
No.
So I hope I have clarified all the questions. I know it is really a difficult time for you, but as I mentioned, we do have some solutions too. Okay, so I hope you will consider those.
Yes.
And if you require any further help, please feel free to contact us. Okay.
Yes, sure.
Thank you so much for your time. You take care. So by that, we have come to the end of this role play. Hope you guys enjoyed it and it's clear for you guys as well. So as you guys have seen just now, we were dealing with a 22-year-old student with vitiligo, and the case is really sensitive because emotionally the student is really vulnerable.
Yes.
The patient is vulnerable because she is a college-going student and she is really worried about her appearance, how others will be accepting her because she is socially kind of like detached at the moment. So we need to provide a lot of reassurance, and in this role play, the nurse was trying her best to support this patient emotionally too.
And one thing what you should concentrate here is the nurse was giving correct reassurance. We were not giving the false reassurance.
Exactly.
Always in such cases, make sure that you give a true reassurance than a false reassurance.
Absolutely, especially when you have to come across tasks where you have to explain that there is no cure. I have seen many students trying to cover it up by saying, yes, we can do something about it. But when there is no cure, you have to be direct.
That is what your role play is asking you to do.
Yes.
You need to do or you need to tell them how to tackle the situation by saying that it is not curable.
Absolutely. But when you say that it's not curable, it has to be tactfully explained too. You cannot be blunt. You cannot directly tell the patient, no, it can't be cured, because it's a sensitive information that you're handling. So that is what we have shown in this cue card, and I hope it was clear for you guys. So straight after this role play, there will be the feedback session where we'll discuss about how easily you can construct statements. So stay tuned. We'll come back with another role play very soon. Take care. Bye-bye. Hello everyone, welcome back to another feedback session. I'm 𝗥𝗶𝗃𝘁. So we just watched a video where we are talking to a 22-year-old college-going student who has been diagnosed with vitiligo. And the patient has approached the nurse to gather information about vitiligo, about the spread of it, whether there is any treatment options available. So you just watched it and you saw how you can build the conversation, okay? So in this particular feedback session, we are going to pick each task one by one, and we are going to see how easily we can create sentences. So I'm not going to explain the entire role play because you have a video reference for that, so you can see how to build the conversation, or what about the introduction, what are the acknowledgement statements that you can use, what are the reassurance statements that you need to inbuilt in it. So you have an idea about that. You can have a reference from the video. So in this particular session, what I'm going to do is I'll pick each task and we will see how we can frame the sentence, okay? So the first task, greet the patient and inquire about the reason for her visit. Since it is an unknown case, we are going to start. Good morning, my name is Richa. I'm one of the registered nurses working in the skin clinic. Okay, how can I help you today? That is the next part. Inquire about the reason for her visit. Okay, either you can simply ask, how can I help you today? Or what you can do is you can frame another statement from the very own question that is given in the task. Inquire about the reason for her visit. May I know the reason for your visit? Okay, that is one way of doing it too. So either you can pick and frame a statement from the very own sentence which is given here, or you can ask the very basic question like, how can I help you, okay? Or how can I be of help to you today? Is there anything I can do to help you today? Any question like that, okay? Up to your convenience. So that is how you can do task number 1. Moving on to task number 2. Consult the patient and explain vitiligo, condition in which skin loses its pigment cells. Explain the cause occurs when pigment producing cells die or stop producing melanin. Exact cause unknown, may be related to autoimmune condition, family, hereditary, trigger event, stress, severe sunburn, contact with chemicals. Too many information, too much, right? So we have 2 different segments here. In the first segment, you're actually 3 segments, okay? Because in the first segment, you're consoling the patient. Second segment, you're explaining vitiligo. Third segment, you're going to explain the causes. What are the different causes, okay? So you can plan to break it down. After consoling the patient, you can break it down and you can check the understanding of the patient's, understanding of vitiligo, what the patient knows about vitiligo, and then you can explain what is vitiligo and check the patient understanding, okay? Is that clear for you? And then you can move on to the causes, okay? I would like to discuss about the causes, and then you can explain the causes, and once you finish explaining the causes, you can check the patient understanding again. I hope it is clear for you, okay? So this is how you have to break it down. So let's see how you can console the patient here. So here you have to understand one thing. You're talking to a 22-year-old college-going student, and that particular student who's very young, teenager, okay, not exactly a teenager but still very young person, that person has been diagnosed with vitiligo. Okay, so you know people do care about their appearance and how important it is for a college-going student. It might affect their confidence, they might be sidelined, they might be bullied. So it is a very emotionally overwhelming situation for your patient here in this particular scenario. So whenever you pick the consoling statement or whenever you pick the empathy statement, make sure that you understand the emotional state of the patient that you're talking to. So here we understand it is a very vulnerable situation for a patient. So when you give an empathy statement, make sure that you relate to it, okay? So when you ask the patient, may I know the reason for your visit, the patient is going to definitely tell you, I have been diagnosed with vitiligo and it is affecting me because I am actually noticing loss of skin color in patches and it is really bad. I'm so worried about it. So the patient will give you an explanation, okay? So you can say something like, I can only imagine how emotionally upsetting that is for you, but please don't worry, you have reached the right place and I'll do everything to provide all the information that you require from me. Okay, so that is a very beautiful consoling statement that you can use here, because you try to explain to the patient that yes, I can only imagine how overwhelming it is for you. Okay, I can't do anything more than that because it is very difficult, I understand, so I can only imagine how overwhelming it is for you, but please be relaxed. Okay, you have reached the right place and I assure you that I will provide all the information that you require from me. Okay, so that is a very good empathy statement that you can use there. And after that, you're going to explain vitiligo. So before I get into the explanation, could you please tell me what you know about vitiligo? So it is very important that you always check the patient's understanding about a condition or an illness the patient has, because it is an assessment criteria. It comes under the assessment criteria, okay, information gathering. So you need to check what the patient knows about that particular condition. So whenever you are going to explain a diagnosis, always keep in your mind to check what the patient already knows about it, okay? So here, before you do that, okay, before you check with the patient, like, could you please tell me what you know about vitiligo, you need to ask the name and the age of the patient, because we need it for the documentation. Okay, so let's call this patient Susan. So we are checking with Susan. So Susan, before we get into further discussion, let me check what you know about vitiligo. So Ms. Susan is saying, well, I don't know much details about it. All I know is that it is a condition which I lose skin color in patches. Okay, so you are saying, don't worry, I'll give more explanation about it. And you can explain by saying, vitiligo is a skin condition in which you lose, in which the skin loses its pigment cells, okay, and that is when you experience loss of skin color in patches all over, Got it? So that is how we can explain it. Okay, one more time. Vitiligo is a skin condition in which the skin loses its pigment cells, and that is when you experience loss of skin color in patches all over. Got it? And then you can check with the patient. Is that clear for you? Or you can ask something like, are you following me? Do you understand? Are you getting what I'm saying? Okay, you can ask a question and check the understanding of the patient, which is a must too. Okay, so the patient is saying yes. Sometimes the patient will say, yes, I understand. So what causes it? The patient might ask you. Sometimes the patient might not ask you. So in either cases, if the patient asks you, okay, what are the causes, you can say, please be relaxed, I'll explain that to you, and then you can start with the explanation. If not, if the patient just said, yes, I understand it, okay, and the patient didn't ask you another question about what are the causes, so what you can do is you can take the initiative and you can explain it. You can say something like, so now I would like to discuss about the causes. That is one way of saying it. Or you can say, Miss Susan, I do understand that you must be wondering what would be the reason behind it. Okay, I'll explain what are the reasons. And then you can start the explanation. Okay, so these are different ways of doing it. Okay, and once you start explaining, you can explain vitiligo. This condition occurs when the pigment producing cells die or stop producing melanin. Okay, however, the exact cause is unknown. Studies show that it can be even related to autoimmune condition. It can be even related to autoimmune issues, or it can be related to autoimmune condition. Or if it runs in the family, there is a possibility it might be passed down. Or it can be even caused due to certain triggering events such as stress, severe sunburn, or even contact with chemicals. Okay, so that is how we can explain it. We'll say that one more time. Okay, so this condition can be caused, or it occurs when the pigment producing cells die or it stop producing melanin. Okay, however, the exact cause is unknown. The studies show that it may be related to autoimmune condition, or if it runs in the family, there is a possibility it might be passed down. Or it can be even caused due to certain triggering events such as stress, severe sunburn, or exposure to chemicals or harmful chemicals. So these are the various reasons why a person might get affected or might be suffering from vitiligo. I hope you understand. Okay, or you can add something like, I know it might be overwhelming for you, or I understand that it's a very difficult situation for you, something like that. I hope you understand. Something like that. You have to make sure that after you finish the explanation, you indicate a stop and you check with the patient how the patient feels about it, because you have to always, explore the patient's expectations, their concerns and their worries. Okay, it will only help you to boost the score, so you have to always do that. So that is how we can do task number 2. Let's look into task number 3. When asked, explain that the spread varies from person to person, spreads quickly within 6 months or sometimes up to 1 year, stops abruptly, remains stable without changing. Let's create a statement. So when asked, okay, so you can ask the patient a question. For the patient to ask you a question, okay, that when asked has to be satisfied, right? So you can lead or push the patient by asking a question. So is there anything else you want to ask me about this condition? So yes, the patient is saying yes. What about the spread? Okay, so you can say, well, I understand that you're overly concerned about this condition. If I were you, I would also be reacting the same way. And I do understand that you're concerned about the spread of this condition. Well, I'm sorry to say that the spread varies from person to person. Initially, it spreads really quickly for the first 6 months, or sometimes it for up to 1 year, and abruptly it stops, and after that it might remain stable without changing. So we won't be able to predict it. Okay, we cannot predict the nature of how it would spread or how quick it would be. Okay, we can only tell the patient that For some people, the vitiligo might spread really quickly for the first 6 months, or sometimes it might be even spreading up to 1 year, and then abruptly it might stop and then remain stable for some time, okay, without any changes. So you have to explain that, okay. So that is how you can explain this point. I'll show that one more time. You can explain to the patient, well, speaking about the spread, or you can say, you can use the acknowledgement statement that I told you a little earlier. Then you can say, well, I'm sorry to say that the spread varies from person to person. For some people, it spreads really quickly within the first 6 months, or sometimes it can even go up to 1 year. And then suddenly it stops and remains stable without any changes. Okay, and I'm sorry to say that I won't be able to predict predict the proper spread rate, or I won't be giving you a clear-cut explanation about about the spread of this particular condition. I hope you understand that. Okay, so that is how you can do task number 3. Moving on to task number 4. Tell the patient treatments can improve the appearance of the skin but no complete cure. Sunblock, UV light therapy, skin depigmentation and repigmentation. Okay, so here we are going to explain about the treatments, right? So here what you have to do is, you can connect it to the previous task if you want, because in the previous task you're explaining about the spread. So when you tell the patient that you can expect a spread for the first 6 months or sometimes up to 1 year, the patient will be like, okay, so if it goes on like this for about 1 year or 6 months, it is going to look really worse. Okay, the patient will have that thought in the patient's mind. So what you can do is, once you give out a very negative, upsetting information like that, you can connect it to the next one by saying that there are certain, treatments. Okay, so you can connect it. So you can use however. All right, you can say something like however. So if I connect it to the previous statement, my previous statement was, for some people, it might even go up to 1 year and then suddenly stops and remains stable without changing. I hope you understand that. The patient is saying, yes, I understood that. However, Miss Susan, if at all it gives you any peace of mind, okay, you can use that phrase, if at all it gives you any peace of mind, let me tell you, there are certain treatments that can help to improve the appearance of your skin, okay, but I'm sorry to say there won't be any complete cure for it, but to an extent we can improve the appearance of your skin, okay. There are treatments such as sunblock, UV light therapy, skin depigmentation or repigmentation, okay. So please do not give up your give up your hope, because there are certain possibilities, there are certain ways through which we can definitely make your skin look better, okay. So please do not lose your hope, okay, something like that, okay. So that is how you can do task number 4. Moving on to task number 5, advice on a nutrient-dense diet, plant-based diet, rich in antioxidants, increased fluid intake. So that is something like an additional information that you're providing to the patient. Like you're telling the patient, if you try to do this, if you, it will be good if you can follow this particular diet pattern too. So that's kind of like an extra info that you're providing to the patient. So what you can do is, once you finish task number 4, you can support the patient by doing something like, so please be optimistic, or please don't lose your hope, okay. And then you can check with the patient. So I hope I have given you all the information about vitiligo. So is there anything else you would like to discuss with me? So the patient is saying, no, there is nothing else, okay. So then you can tell the patient, so Miss Susan, before you leave, I would like to tell you one more thing. Please make sure that you take a proper nutrient-dense diet, okay. A plant-based diet which is rich in antioxidants is really good for your skin, and please make sure that you increase the fluid intake as well. Always stay hydrated, okay. I hope you will consider all these suggestions. So Miss Susan is saying, yeah, sure, I'll consider this, okay. So that is how we can do task number 5. Alright, because in task number 5 we are explaining advice on a nutrient-dense diet, plant-based diet, rich in antioxidants, increased fluid intake. It's very easy to construct the statement there, okay. It will be good if you can follow a nutrient-dense diet, because a plant-based diet which is rich in antioxidants is really good for your skin, and make sure that you increase the fluid intake too, okay. I hope you will consider my suggestions. That is how you can explain that, okay. So that once you finish all this, then you can check with the patient. So is there anything else you would like to discuss with me? So the patient is telling you, no, that's all. So when you give a summary here, or when you give a conclusion here, what you have to do is give a little bit of reassurance and relate to the emotional side of the patient, and then give a conclusion. That will be a little more better, okay. So we understand that the patient is vulnerable here, so you can tell the patient, well, in that case, I hope I have explained all the points to you, and I do understand that it is not very easy for you, but please don't worry about it. As I told you, there are certain treatment options available which can help us to improve the, which will help to improve your the appearance of your skin. So please be optimistic, and if you would like to discuss further about your treatments, you're always welcome here. Okay, so that is how you can finish this conversation. So I hope it is clear for you guys, and for the future reference, you can always refer to the video, and then you will get a clear idea about how you can move the conversation, very smoothly from one task to another, and give the required empathy and reassurance wherever required. Okay, so I hope it is very clear for you guys. I'll see you guys in the next video with another role play and another feedback. Until then, take care. Bye bye.
IILT, it's my cup of tea.